Hello everyone. Today I want to discuss a critical bioethical issue in healthcare: the administration of gender-affirming surgeries and chemical castration in minors and the ethical concerns surrounding them. Recently, this issue has gained national attention due to the Executive Order 14187 signed by President Donald Trump on January 28, 2025. The order restricts federal funding for hospitals and healthcare providers that offer gender-affirming surgeries to individuals under 19. Many argue this protects minors from making irreversible decisions before they reach full maturity. However, the order has faced legal challenges, and on February 13, 2025, a federal judge in Maryland temporarily blocked it, allowing some hospitals to continue these procedures. This situation raises critical questions about informed consent, the potential for long-term harm, and the appropriate role of medical professionals in treating gender dysphoria among youth. The primary ethical dilemma here is whether minors should have access to the irreversible medical procedures when they lack the cognitive and emotional maturity to fully understand the consequences. The principle of non-maleficence, or do no harm, is particularly relevant, as gender-affirming surgeries carry permanent effects such as infertility and irreversible physical changes. Additionally, autonomy is limited, as minors may not have the capacity to make such life-altering decisions, and parents or legal guardians may face pressures from social and political influences rather than purely medical reasoning. According to the American Nurses Association Code of Ethics, Provision 3 states that nurses must protect the health, safety, and rights of patients, and Provision 4 highlights the responsibility to provide sound, evidence-based care. Given that some research suggests a percentage of individuals regret transitioning, these ethical principles call for a more cautious approach before allowing such irreversible medical interventions for minors. As a nurse, this issue is important to me because it directly affects how we safeguard vulnerable populations such as minors from potentially harmful or premature medical interventions. The long-term psychological and physiological effects of gender-affirming surgeries are not fully understood, and healthcare policies should be rooted in patient safety, medical ethics, and long-term well-being. The policy and advocacy implications here include ensuring that healthcare decisions for minors are based on fully developed medical research rather than social or political trends. My recommendation is that minors should not have access to gender-affirming surgeries until they reach an age where they can fully comprehend the consequences of such irreversible procedures. Instead, they should receive mental health support, counseling, and non-invasive interventions until they can make an informed adult decision. To guide our discussion, I'd like to ask, should minors be allowed to make irreversible medical decisions, or should they wait until adulthood? How can healthcare professionals balance the need to support transgender youth with the imperative to avoid potential harm from premature medical interventions? And finally, how can healthcare policies better balance patient rights and protections for vulnerable populations such as minors? I'd like to hear your thoughts. My name is Ben, and thank you for listening.